Welcome to your vitamin, mineral, and essential oils supplement guide. Make sure you're supplementing for deficiencies instead of supplementing for the sake of supplementing because everybody else takes this. So go through the video or the audio, whichever you have, write down the name and what you would take that particular supplement or mineral for, and how often you take it, when you take it, if it's a daily, if it's an intermittent, how when you take it and how often. Just write down all the details that you can about that particular supplement, especially if you feel like that would benefit you for your particular issues of deficiency. If you have any questions, feel free to contact me. Ashwagandha. It's actually an evergreen shrub that shows up in Asia and Africa, but commonly it's known for its calming effect. It calms the brain, reduces swelling, lowers blood pressure. It helps alter the immune system to be able to overcome the oxidative stress that we get from our water, our soil, our air, and our food. And ashwagandha has been known to help not only reduce stress but improve sleep, boost athletic performance, improve memory, increase male fertility and female sex drive, as well as, remember, reducing inflammation. But it also helps reduce and manage blood sugar. But it also reduces the production of cortisol, which will in turn help you reduce belly fat from the stress. Okay, so this is especially good for after menopause, for postmenopausal women. It's best to take at night, but certainly if your life is stressful, it's okay to take it also in the morning or just in the morning. It's up to you. Your levels of stress, it's up to you to know if you could try it in the morning so that the rest of the day, if you felt better, less stressful, didn't yell at people, didn't bite anyone's head off, then you might want to continue taking it in the morning. So the B vitamins are very, very important. They do a multiplicity of functions, a lot like ashwagandha. They can calm your brain, they can give you energy, they regulate emotions and the generally feeling of well-being, but most importantly, they go from having the various chemicals inside the capsule to creating enzymes to creating amino acids in the brain, which is a vital part for the development of neurotransmitters, which connects your dominant side of the brain to your non-dominant side. Everybody has a certain dominant side of the brain, your right brain or your left brain. And it's not exactly the opposite of your writing hand. If your mom would have let you just pick up whatever hand that you wanted to write with, you may have been a lefty, even though you might be a left brain. So chances are you'll know which type of brain you are, because the left is very logical, organized, the right is very creative and freeing and will run away with the fairies if they think it's fun. A lot of ADHD people are very dominantly one side over the other. As you get older, your brain grows and you'll be able to, by the time you're 25, have two sides of the brain that either function equally or the non-dominant side functions partially to help slow down the brain processes. Another thing that helps slow it down is, besides ashwagandha, would be your methylated B vitamins, and that just makes it a bioactive form. Folic acid is man-made. It's not found on the planet. It can, if you can't absorb it, it's probably because you have a polymorphism, which means in the MTHFR gene mutation, you cannot digest it and it just goes through your body and it actually causes the opposite of what you'd want. You don't get that calming effect. You don't get those amino acids turning into, or enzymes turning into amino acids. Instead, you get anxiety, confusion, the brain racing, and stay away from folic acid. You'll find those all of your grains that are fortified or um, uh, enriched, is what it'll say, are sprayed with folic acid. So you want to get a bread that's not sprayed with folic acid. So you want to look on the back to see if it has folic acid, but you could also look to see if it's enriched or fortified, because things are changing all the time with the FDA, whether or not they have to report certain things. For them to spray folic acid on our grains is giving us a medical treatment in which we do not consent, but you consent if you buy the bread and you eat it. So it's really, really important that you try to look out for these types of things. Even with processed foods, you're going to get grains that were sprayed with this folic acid. So you want to try to eat whole foods. But as far as the B vitamins goes, let me just tell you briefly how to use it. Okay, so a lot of people, I would suggest, if you've never taken B vitamins and you have ADHD, then you probably want to start with the methylfolate, which is the bioactive form of vitamin B9. And that's what they're trying to substitute folic acid for. So you want to start with that. For children, it's 2.5 on a dose. For adults, you might try 7 to 15 milligrams per dose, which is in the morning once a day. You could also, because, we're probably deficient, grossly deficient on all the B vitamins, the Thorne brand I found to be the best brand that I've ever used for the B vitamins. I found a significant calming, my brain slowing down, being able to concentrate better, as well as my son taking these. But if you have ADHD, that means you're an overmethylator, most likely, meaning you get homocysteine in the brain, in the cell, to be too much, and that makes your brain race and not be very calm. So you need to use the methylfolate and the other B vitamins methylated so that you can get the homocysteine to reduce the levels. So your brain will actively do that. If you're an undermethylator, you need to increase homocysteine levels, and this amino acid will regulate. If you have the correct methylated B vitamin, it'll create the amino acid that will regulate your brain for you. So about the 3-month mark, if you're an overmethylator, you might find yourself having racy brain again, anxiety, and the lack of calm. And so all you would have to do is back off on the B vitamin. You've now reduced your deficiency and you're now regulated, and you probably only need to take it every other day. If you want to cut the dose in half by buying a different pill that's half the dose, or if I were you, I would just take it every other day, see if it levels out. If you're still feeling that anxiety, try to take it every 2 days and just work it like that, so that don't think you need more methylphenidate or Adderall if you take that for your ADHD. It's probably just that you're now not lacking in your methylated vitamins. You've finally filled up your deficiency, and you simply now need to bring the levels down to a maintenance level. Does that make sense? So I would definitely try to understand that if you're an undermethylator, that you probably would need more, but you can also overmethylate yourself as well. And I would say for me, I think I could probably stay on a 7 milligram dose the rest of my life and be fine, because I'm an undermethylator. I could probably even take 15, and maybe I will, but I also take ashwagandha. And so I believe that my deficiency is normalizing, and by the time the 3-month mark hit, I hadn't felt a difference. Like I didn't feel like I needed to lower it or up it, is what I mean. But I felt a huge difference taking methylated vitamins with the calm, especially during menopause. And a lot of people don't understand that their normal youth and hormones helps kind of mask the fact that you probably need methylated vitamins. But as you get older and you're not as patient anymore, these are the things that are going wrong in our system. It's deficiencies in these vitamins that have to be methylated. Well, there are so many other things that I could say about a B vitamin, But I think that for energy and feelings of well-being and good health and brain health, and to get those neurotransmitters growing so that by the time kids are 25, their brain can be fully developed. But you know what? The brain is always having death of the cell and regeneration. So these B vitamins will help keep creating those neurotransmitters to keep you sharp, and so that you won't see the form of Alzheimer's. These B vitamins are absolutely vital. Just stop the video and take a look at the back, and you can get familiar with what the methylated forms are called. Anyway, just wanted to show you the back of this one. Cinnamon capsules are really great to keep around for high blood pressure. If you suddenly feel you have extremely high blood pressure, you've already taken your high blood pressure pill, you can take about 4 or 5 caps of cinnamon, and within 20 minutes, your blood pressure's been lowered. Also, if you have too much sugar in your blood, or glucose, I should say, and you're a type 2 or type 1 diabetic, this really helps push it through and bring it down. It's a wonderful little tool to have in your arsenal of vitamins. D3 is another wonderful vitamin to help you with depression, feelings of fatigue. D3 is what everybody seems to be short of. It's the sunshine vitamin. And D3, they say you should be very careful in not taking too much. But, it's kind of like a sunburn is about 180,000 units of D3. So you can take quite a bit of D3 every day. For instance, I would say a normal dose would be 15,000 to 20,000 international units. If you see in the picture, it says 5,000 IUs. So you would only need to take 4 of those for 20,000 units. And it does have a half-life. And you do need to take it with an omega-3 fatty acid such as a fish oil. You could take krill oil, fish oil, or freshly ground flaxseed. And you could do the freshly ground flaxseed, or you can get flaxseed oil in capsules, and that would be great. But you need, because this is a fat-soluble vitamin, you need to take it with an omega-3 fatty acid, which I said what those were. So the D3 is really important not only for the calcium to be absorbed better into your bones, but it's very, very vital for your immune system. In fact, there was a study by a friend of mine, her brother is a doctor, and they tried using high levels of vitamin D3 on flu patients and found that they recovered quickly from the flu by half the time when taking high dose vitamin D3. So they also found that high dose vitamin D3 is good for the prevention of being sick. A lot of people don't get sick when they take D3 in high doses on a daily basis. So D3 is very important for your energy level, I would say, and it does help beat the winter blues. Why? Because it's sunshine in a bottle. And because it is sunshine, you'll want to take it in the morning with your fish oil or krill oil. This is natto kinase, and this is a wonderful support. It says for cardiovascular health, and the reason why is because it's an enzyme, and it's extracted and purified from a Japanese food called natto, and so they'll boil it, and and they'll ferment it, and they'll add the bacterium of Bacillus subtilis. It's like a probiotic, and it also produces an enzyme to boiled soybeans, and the ultimate result is that if it comes in contact with a clotting, like a blood clot in the blood, or any other proteins laying around or cholesterol, it breaks it up. It has a very active enzyme that starts to break that up. So what would you use this for? You would use it for high cholesterol, and you don't want to use it but at night, and I would only use it 30 days at a time, and maybe take a couple weeks off and then take it again for 30 days and then another couple weeks off. And you can keep it in your rotation, but I would be very careful have your cholesterol checked. It's really, really great for supporting um, the heart health from having plaque and your body from having too much cholesterol. So this is the sister to the nattokinase. This is the serrapeptase, and you can take that at night if you're going to take the other in the morning for a quick cholesterol cleanse. But then you're going to want to just back it off to just one of them at night for the next month, and then just back it off to do it intermittently, like for 30 days, and then take 2 weeks off, and then 30 days, and then maybe go without it for a month, and then do it for the next month. You just want to be careful with these type of aggressive things. You don't need to use it every day. These are more like something that you would use to get rid of cholesterol and do intermittently now and then in order to solve a problem. So, one of the things that could happen if you deliberately know that you feel like you're clotting somewhere in your body, and if you were to take this, the clot could and might just relocate somewhere else instead of breaking up properly. Um, it does improve liver function. It's very safe for the kidneys. It's really good overall to clean your veins, reduce the size of the arteries in the heart so that your blood pressure will go down. So it is a wonderful cleanse to do now and then, like I said. So the niacin, if you've ever taken niacin, it is not fun. I do not like the feeling of the flush and how it makes my skin feel. So I quit taking the niacin, and now I just use the serrapeptase and the nattokinase. So, I mean, you could use niacin occasionally, but that's not something that I like. But you can also get an anti-flush niacin, but how really effective is that? Perfect aminos. These are amazing. If you need to have energy of mind, body, and spirit that day, in fact, in the morning I'm good because I've had a night's rest, but then about midday or afternoon, I am dragging. You can take 2 or 3 of these, and it gives you many of the amino acids that you need to have energy and vitality. And literally, they have saved my bacon when I really just needed to get through the day. Would highly recommend these. Also, you're not pushing yourself with caffeine, which is a fake energy, and wearing out your adrenals in order to have that sort of wakeful feeling with caffeine. And caffeine isn't good for your heart or anything else. So these perfect aminos are the perfect substitute for caffeine. And you can take up to 5 a day. You can take a couple in the evening if you still have to get through until 10 o'clock. So, selenium plays an important role in the health of your immune system. This particular antioxidant helps lower the oxidative stress in your body, which reduces inflammation and enhances immunity. So, if you're someone that has chronic inflammation, selenium would be great to add to the arsenal of your daily vitamins. But doctors warn not to take more than 400 a day, 400 milligrams a day. And most seafood contains high levels of selenium. So if you're taking this every day, don't eat seafood a lot unless you're backing off on the selenium, which there's no reason for you to back off on it. I think it's like a white fish, like halibut, has about 92 micrograms of the mineral, while maybe a bunch of canned sardines contain 45 milligrams. So you don't get that much more. So maybe this one has 200, and so you can just take 2 of those a day. You can even take one in the morning in your morning pill and one at night for your night pill. Selenium also helps infertility in men and women. A lot of people could really use selenium. It helps with muscle weakness and fatigue, and mental fog, hair loss, weakened immune system. Um, it's really interesting that people don't really study vitamins enough to understand they could treat their deficiencies and have a better life just by understanding vitamins better. And that's what I did. I wanted to know. So there you go. So, why take potassium? Well, it allows the nerves to respond to stimulation and for the muscles to contract or tighten, including those in the heart. It reduces the effect of sodium, like present in table salt, on blood pressure. A lot of times, congestion, heart congestive heart failure is from having too much water surrounding the heart, and the potassium helps keep the excess water off of the heart. So it helps move nutrients also into the cells and the waste products outside the cells. Um, it's important that you don't take too much potassium. For instance, your total intake of potassium shouldn't be greater than like the recommended amounts on the bottle. That's what they always say, and that's what I would say because I'm not a doctor. You can talk to your doctor about a healthy daily dose, but in some cases, too much potassium can cause muscle weakness. Isn't that weird? An irregular heartbeat or difficulty breathing. So if your potassium is low, you'll have the muscle weakness, muscle cramps, abnormal heart rhythm, the same as too much. And that is the same with any vitamin. For instance, when we talked about those methylated B vitamins, the when you're taking them every day and all of a sudden you're getting symptoms like before you started taking them, that means you're getting too much. Your deficiency is now complete. You are right on track and you need to just maybe take it every other day. So I would definitely recommend that you take the potassium only as directed on the packaging, and possibly if you're feeling, um, you got to listen to your body. Um, the the potassium could essentially give you more energy because it does impact high sodium in our bodies and it regulates blood pressure. So you might feel more relaxed, which you feel like doing more things. But when you have high blood pressure or there's too much salt in your system, you feel swollen, you feel like maybe you have some inflammation, and then you're not going to feel like you have energy. So um, you need to be careful that you're paying attention to your symptoms whenever you have symptoms because it could be a result of having too much of a particular vitamin or not enough. Okay? Oil of oregano, my brand new favorite go to. So, if you have a new virus that's just coming on and you can tell you're starting to get ill, whether it's bacterial, viral, or a fungus, oil of oregano can help. And I take 2 of these capsules 3 times a day until I feel like, oh, I'm over it. And then I take a look back at the day I started and count how many days I've been taking it to get better. And that's how many days I keep taking it so that I can make sure that it's completely gone. Okay, that's a good rule of thumb. Now, the oil of oregano, the only side effect I've ever noticed is burping and kind of tastes like oregano, like I've maybe had pizza or spaghetti. Some people don't like that. I would take it with food just in case that it's too strong, mostly for young tummies more than old tummies, or I would definitely take it with food. So that should help. Much like oil of oregano, this silver water or colloidal silver actually fights bacteria and viruses. And in certain colloidal silvers, they say you can treat cancer or AIDS or COVID-19, shingles, herpes, acne, eye diseases, gut health, different things like that. Different people say different things, but this particular brand of silver water is made with a lightning bolt tuned at the frequency of the Rife machine's cure for cancer. It is that lightning bolt is put in the water with a 99.9% pure silver, and the silver particles, the nanoparticles, explode into the water, filling it with billions of particles. And that's what colloidal silver is. And so the benefits can also be topical. Like for pink eye, you can take a dropper and put it in your eye for pink eye, or you could treat wounds like burns, skin infections, and things like that. This is something that you would only use during the duration that you're sick. You can couple it up with the oil of oregano if it's really bad, and you might see a quicker recovery. The only thing I would strongly want you to know about colloidal silver is you do not want to take it more than 3 months at a time. In fact, you do not want to take more than the 30 ppms a day. You don't take it more than once a day. And what I say is ppm is a capful. Take one capful of this a day in your water. That's it. Do not use it for more than 3 months. I wouldn't even use it that long before you stop using it and now the reason why you would use it for 3 months is if you were fighting cancer. And in fighting cancer, you would use like fenbendazole or some kind of dewormer. And then, while you're taking dewormer, you're going to be taking ground clove capsules so that it prevents the worm's eggs from hatching. And so you'll deworm and then for 2 weeks, and then you take clove for 2 weeks, and then you start deworming again for 2 weeks, and then you take clove for 2 weeks. And then once you've done that cycle about 3 times, then you start taking colloidal silver for about 3 months, because then it heals the body from the remnants of the dead worms and their sacs. And so here's the company in which I got this particular product from. And you do not want to take it more than the 3 months at a time. In fact, I would only do it 2 months and then stop for a couple weeks and then start again, because people have taken it in the past for more than 3 months, started to turn gray, like the pink left their body and they started to turn gray. And there are people, they call them blue people, because they use 330 units of the silver every day or more, 360, I think it was, sorry. And I'm doing it by memory. So, but you don't want to take it any more than you need to take it, which is when I think for sickness, I think 2 weeks is probably good, and then you can stop taking it. And then when you get sick again, take it again. But don't forget the topical, because as a topical, it is absolutely amazing at keeping infection away from like a burn or a bug bite. And because if you have a topical sore, it can go sepsis into your bloodstream very quickly, and then you're in big, big trouble. So, silver water or colloidal silver can be a tremendous tool for your health. So, for getting better, it's always good to remember the different things that you have available to immediately start using to get better. But sometimes, an ounce of prevention is worth a pound of cure. And in this case, you can't really see the words, but right smack dab in the middle, the black container, that is my iodine tincture. When there's iodine present in the system, you cannot develop cancer. Iodine is also very helpful for the thyroid, which is the rate you burn calories, which has everything to do with your metabolism and definitely your energy level. So it's really important that you're taking iodine, whether it be my tincture or perfect iodine from Amazon. But I tried that. I never really noticed a difference. But when I started taking my tincture, I noticed a difference. And sometimes I'll take it twice a day. Like I'll do one dropper full in the morning and one dropper full in the afternoon if I'm having a rough energy day, along with perfect aminos. You remember the perfect aminos I told you about before. Also, thieves oil is good for prevention. You could put it on the bottom of your feet. You could put it on your wrists, on the back of your neck. You could also, put it on your wrists or on the front of your neck. It smells like Christmas, so it's quite lovely. It's called thieves oil because in the time of the Black Plague, thieves that robbed bodies wore this so that they wouldn't get the plague. And so the authorities said, okay, we won't arrest you and throw you in jail if you told us how you didn't get the sickness. They talked about the thieves oil, and then they gave up the recipe, and then they didn't have to go to jail and be incarcerated. So we get thieves oil from the thieves that stole from the Black Plague. I also have I think tinctures, so this is about tinctures and essential oils, but I think tinctures, because the vodka disassembles all the really great essential ingredients and chemicals within the plant. It's great to have a tincture because then you get all the essential parts with none of the excess. This is a mullein tincture on the other end on the right, and you can take 2 droppers a day. It is amazing for your lungs if you are an asthmatic, or you generally have lung issues or breathing issues. It's really, really great. It is especially for the lungs. So these are a couple things that I do and that I take, and you can choose to do it in the future or not at all. Another really great combination of essential oils that I'll just bring up right now is lavender oil and peppermint or spearmint. I love lavender oil with spearmint because it just it makes me very wakeful and calm. And so I'll put it on the back of my neck, on my wrists, under my neck, in the front so I can smell it. If you have a sensitive skin issue, then I would probably rub a little in your hand with some coconut oil or extra virgin olive oil, and then put it on those parts of your body or the bottom of your feet. The bottom of your feet is used when you want to detox or you want to get something in or pull something out. But if you want to smell it because it does something for you, which, aromatherapy is wonderful. And so, anyway, I could go on all day about essential oils. I've made about 104 recipes of them, and I can send them to you as you need them or ask for them, and you can start using essential oils for yourself. So this next one is ProPause 50, and it's basically for women 50 and above. This is made from yam extract. It is to give you the progestation hormone that you are now lacking. Women can start lacking progesterone as early as in their mid 30s. And some even earlier, especially in today's age where we have toxins in our food, our water, our air, and in our soil. And much of the time, the toxins that are presented have something major, a major effect on our reproductive system and our ability to procreate. So I would highly recommend, if before, during, and after menopause, that you start using this ProPause twice a day. One pump on the soft parts of the inside of your right leg, and then at night put it on the inside of your left leg. In the next morning, use the soft part of your tummy on one side. At night, use the soft tummy on the other side. And the next day, you can use the inside of your left arm, and the next day, you can use the inside of your right arm. Just rub it in until it's basically gone, or it's sticky instead of really wet. And that will give you enough progestation hormone for the day. It will calm you if you have anxiety or your mind is racing. And this is only for women. I would not suggest using this for men. And basically, that's it. You don't have to use this brand. There's other brands. Just make sure it's made from wild yam extract and that it is pure GMO free and or non-GMO, and that it's organic so that you don't get any of that bad stuff. So, magnesium oxide, this is the basic one you're going to see at any store to go pick up magnesium. You turn it around on the other side, it'll always say oxide. And so this one is used to treat migraines, constipation, reduce blood pressure, blood sugar, and anxiety in certain populations. Of course, certain people have different needs, but it is a lower bioavailability than other forms. And so I found that there's all kinds of magnesium. The best one, for instance, to take to prevent or cure arthritis. It's not going to, it's not going to prevent or cure arthritis, but it does have a strong evidence line of support that says magnesium can treat arthritis related inflammation, and the kind is magnesium chloride. So this form of magnesium is often used topically and has a little spray that you put on on your, like, the inner soft portions of your body, like you would the progesterone that I suggested. And so you'll just, there's lotions that you can use or oils that you rub in, and it does support muscle and joint health. And that one is really, really nice to get. And it costs a little more because it's the bioavailable form. It's the most absorbed. But, I think the best place to put it would probably be right where you need it. But the soft parts of your skin are where they get absorbed better. But, you could try putting it directly on and see if it works better than just putting it in the soft parts of your skin. You can have up to about 450 milligrams per day of that particular magnesium, and definitely take it at night. Magnesium helps you sleep. It helps with a myriad of things. But, another vitamin that helps with arthritis is vitamin D, which we'd already talked about, vitamin D3. In fact, well, there's so much I could say. I could go on all day. But for inflammation and pain, which I would say is probably better to take as a magnesium than what they say is best for arthritis, because the cause of pain is inflammation. I would say the best form of magnesium that would reduce, let's say, brain inflammation and give you pain relieving properties, especially if you have poor brain health, like with dementia, tremors, autism, ADD or ADHD, um, uh, dementia, different things like that. I would definitely try the magnesium threonate, which is THREONATE, threonate, L-threonate. And it's definitely something to try. I mean, you could try one at night, the other in the morning, but you really shouldn't take more magnesium than as directed. There's always that chance that, remember, if you take too much of something, it's the same as not having it at all, and the deficiency of it, the symptoms are the same. So you want to slow down arthritis. You could try the glucosamine and chondroitin for joint pain relief. That's good every day too. You could take that with the magnesium threonate, the L-threonate magnesium. The other magnesium that's good for arthritis, remember, that's the um, gosh, I just went blank. The chloride, the magnesium chloride, that's the one that's topical. So you can try either one of these to see which one you really feel a difference. And that's what's really important, because we're all different. We have different DNA. Some of us have gene mutations that make it so that we don't absorb vitamins well. Some of us are very sensitive to vitamins, and so we don't need to take very much of them, where other people need to take more. So you see what I mean? So it's just different. So there are all types of magnesiums, and you can look it up. There's a magnesium chart that will talk about. There's more than 13, but they're not telling you everything. I looked up an article and it said there were 13 different types of magnesium. There's even, the magnesium sulfate is the Epsom salts. And the oxide is what they always keep at the store. The citrate does general digestion for migraines. That helps for migraines. Well, so does the oxide. And the magnesium chloride, we talked about the putting it on your skin. And the magnesium glycinate has good bioavailability. It's good for mood, sleep, and calm. That's the glycinate. And for you, maybe you want to switch it. every week you're gonna, first week, if you're feeling your arthritis, then you want to take the threonate, the L-threonate, and maybe you want to have more calm, so you're going to take the glycinate. Maybe if you're not having a good digestive system, you take the oxide. So you can look up these different magnesiums and what they do for you, and keep all those around so that you can switch it according to your needs, and there you go. That's magnesium. So there's different reasons why you would want to take CoQ10. You can reduce swelling in your legs if you get a lot of water retention, especially if you're in a job that has you sitting most of the day. It also reduces the fluid in the lungs, which is really important for asthmatics and generally people that are in poor health or otherwise need help in removing fluids from the body, like heart disease. It'll also make breathing easier because of the reduction of fluid in the lungs, and increase the capacity to have exercise, which could in general help you avoid heart failure and keep you healthier and thinner. And not that thin is healthy, but it could help you, by exercising, you could reduce the amount of fat in your body. But the CoQ10 could also help reduce the lipoprotein, which is the cholesterol and total cholesterol levels, not just the LDLs. But especially in people that have sugar issues, that maybe have a larger belly around the middle, but everywhere else seems fine. Um, you can lower your risk of heart disease by taking CoQ10 to help regulate your cholesterol. So, CoQ10, and it's just kind of interesting that it reduces harmful compounds that can increase your risk of neurodegenerative diseases such as Alzheimer's and Parkinson's. And this is important because Parkinson's has tremors. Parkinson's people, they're very shaky. And so um, I I thought, people with ADHD, they need um, high levels of fatty acid, omega-3 fatty acids, and it's really good for them because um, a lot of ADHD kids are ADHD because of fluoride in the water, because fluoride releases an enzyme that tells the enzyme to begin cell death in the brain. And so they're finding that it takes place in vitro, the ADHD, and that it's also caused from polymorphisms. It's um, it's pinpointing of one thing, maybe not, but certainly folic acid exacerbates ADHD and other polymorphisms. But the CoQ10 can also help reduce the harmful compounds that increase our risk of these neurodegenerative diseases. So that's really good. It's probably because it's a heavy metal detoxer. And so is Epsom salts when you have an Epsom salts bath with bentonite clay, sodium bicarbonate, baking soda, and even borax. We need boron. It's an essential element. So if you don't have, and you don't want to take like a little eighth of a teaspoon in a liter of water every day to reduce pain and inflammation from arthritis, you could also just take a bath in it, where your epidermis, which is your skin, soaks it all in. So there you go for CoQ10. Vitamin C is essential to keep around. Not only does it help keep up your immune system for optimum health so you don't get viruses and other sort of things, but also most of the other vitamins depend on vitamin C to have absorption. So, for instance, when for women, we need to take an iron supplement every night. And with that supplement, we should take vitamin C for absorption. In the morning, whatever vitamins you're taking, you can also take vitamin C in the morning. You can either take 4 1,000 unit vitamin C capsules or tablets, or you can just chew away these yummy, they're like candy. They're very, very chewy. I've learned to love them in this form because this is a form my husband loves. And so instead of swallowing the pill, which sometimes can make your stomach upset, it's really good to take vitamin C in the chewy form. So I would recommend, this is also a push for iron for ADHD, adults and children. Iron is absolutely necessary to help them overcome their fast brain and other ill health. A lot of people that take stimulants aren't getting enough nutrition anyway. So, whatever vitamins you can give them, that's great. I always recommend separating the vitamins and taking them at different parts of the day because there are vitamins that cancel each other out. Like if you take this iron pill with this vitamin C in the morning with your D3, it'll bind with the D3 and you won't get any of the positive effects. So if you take iron, take it at night before bed with your magnesium and your vitamin C and ashwagandha, and that will be perfect. Perfect, perfect. But definitely take this twice a day. So if you're taking it twice a day, then you can split up 2,000 in the morning and 2,000 at night, or you could do 1,000 in the morning and then right before bed you could be munching on these. That's kind of a nice treat. So I once saw a video about a woman who didn't use any beauty products on her face, but took just the right things, kind of vitamins, and that it um, helped her skin look really, really great. So I know that collagen peptides are the most effective for improving skin hydration and elasticity, which will, for pain and joint function, or people with knee problems and shoulder issues and back issues, that the collagen can help those joints feel better. So it's a great way to look good and look younger and have better looking skin and also improve joint function. So it's just something that I use. Maybe you'll like it too. So, with the tremor issues, Parkinson's, a peripheral artery disease, insulin resistance, non alcoholic liver disease, oxidative stress, autoimmune disorders, all of these types of things, you want to look to the liposomal glutathione. It is a master antioxidant and it has a tremendous amount of benefit on your body. And you can take it every day, but only for 2 months and only 500 milligrams a day. And before we're done here, I'm going to tell you why you should take 250 in the morning and 250 at night. So, the liposomal glutathione is really good at reducing belly fat. It plays a role in healing the gut and reversing autoimmune diseases, like we had mentioned. There's a tremendous benefit for your skin, for instance, because it's an antioxidant. It'll help clear up your skin. And glutathione is working because you'll see a reduction in the symptom that you're using it to help you with. It does affect your sleep. It helps your sleep because it detoxifies the body at the same time that you're sleeping. Um, there's a lot of real technical things, but if you want to take it in the morning, it's great because it kickstarts your body in the morning or the evening, because in the evening your body goes through a natural repair and detoxification process while you sleep. So choose which one aligns, but I would suggest you take half in the morning and half at night, um, because it also works with magnesium and vitamin B's and vitamin D for like a comprehensive approach to support mental well-being. Okay, so glutathione is one of the most important antioxidants for your brain. And so if you have problems with tremors or Parkinson's or dementia or ADHD or depression, glutathione is going to help you because it addresses oxidative stress and it helps neurotransmitter production and brain function. And these nutrients work well synergistically to promote like your best brain health that you can have. And so, I mean, there's a lot of deficiencies that we have as humans because we have calorie rich um, nutrient what should I say, lack of nutrient food. I didn't know exactly how to say that, but um, and because of that, we have need of supplementation. And don't supplement to supplement. Supplement for your deficiencies, and you'll feel better. And if it's a shot in the dark, I mean, you know your body. You're gonna have to reach out, be prayerful, and there's ways that look up muscle testing that you can do to ask your body what it needs. So there's a lot of pathological conditions that um, glutathione can help, which is like diabetes, cancer, liver disease, HIV, TB, pulmonary fibrosis, Alzheimer's, Parkinson's. So, not having, and Rett syndrome, by the way, and not having enough glutathione can cause these things to um, start to present themselves. So there's that. That's glutathione. Zinc is one of those dailies that you need to take. It's a nutrient. It's found throughout your body. It helps your immune system and metabolism function, but it's also important for wound healing and your sense of taste and smell. That's why a lot of people, when they have a cold, they can't smell or taste. But if you take zinc, that'll get over with really fast. So, usually, with a very diet, really healthy diet, your body usually gets enough zinc. But some food sources are chicken and red meat, and some cereals. But I wouldn't take fortified cereals or enriched cereals because of the folic acid. But zinc helps your immune system fight off invading bacteria and viruses. Yes, it does. It's really great for when you're sick. It's supposedly helpful for reducing tinnitus, and it definitely shortens the duration of cold symptoms. And it supports blood sugar management, improves severe inflammatory acne, decreases heart disease risks. It helps improve the cells in the body. Um, it's the best thing as a immune support to take, especially today when we have all these flu and things going around. And if you're getting older, sometimes the flu is the biggest um, perpetrator of elderly death. So you shouldn't take zinc if you have a history of stomach surgery or ulcers or prolonged intravenous nutrition, like you had throat cancer and you have to use nutrition through the veins. Zinc probably wouldn't be something you'd want to do. You shouldn't take zinc with copper or iron or phosphorus supplements at the same time. So you'd want to space that out. And so you probably want to take that with your vitamin E during the day, just in case you're taking like MSM, because that's a type of phosphorus. Um, taking zinc at night could cause stomach upsets, and you've got things at night you don't want to take zinc with anyway. So during the day, like after lunch, would be a good idea. But I would highly recommend zinc because it is very effective at keeping you well and avoiding sickness. And sometimes, it's an ounce of prevention is worth a pound of cure. If you want to take mineral supplements, that's great. They're the building materials for your bones, not calcium, actually. It influences muscle and nerve function, regulates the body's water balance. Minerals are absolutely essential. If you can get your hands on a very inexpensive bottle, it's really, really great to take. It's probably best taken either in the morning or at night. So I don't think there's a problem with either time. Lysine, it's an amino acid. It's a precursor to many proteins, and so that's why it's important to take it. But let me tell you, there's so much that you can benefit from taking it. It helps the body absorb calcium and plays an important role in the formation of collagen, which, is really important for the bones, connective tissue, skin, even tendons and cartilage. But, most of us get enough L-lysine in the diet, but the health benefits also could help reduce anxiety. And so, whatever we can do to reduce anxiety is good. But most people use L-lysine if they have autoimmune diseases that cause cold sores or canker sores. People use L-lysine to help with athletic performance if they have diabetes and other things. L-lysine will help reduce blood sugar. So, um, mostly mostly people use L-lysine for making proteins in the body. For people that are using having like a high protein diet, they probably want to take L-lysine. That will help benefit all of that protein to be created properly in the body. But other than basically cold sores, there was one doctor that used L-lysine and alpha lipoic acid together and cured his heart disease in 8 months. So keep that one under your hat. If if you're told that you have heart disease, then make sure you're taking your nattokinase and your ceratopsia, Japanese herbs, and you can add L-lysine and or alpha lipoic acid together. And I think that it's just fine to take in the morning with all your other B vitamins. You could also take it at night. It's not going to bother anything. I've checked with the other vitamins that it might interact with and hadn't seen any. So there you go. That's L-lysine and alpha lipoic acid. Vitamin E, other than its obvious, take a pin, poke a hole in it, put it on your hand, and apply it directly to your face or to a wound that you want to have healed quicker, it's been found to be effective in the prevention and reversal of various disease. And so it's an antioxidant, and its role in anti-inflammatory processes helps prevent and reverse disease because inflammation causes more disease when inflammation is present for a long period of time. So it has an immune enhancing role in the body as an antioxidant. So that's really, really, really good. But you can, there's risk of side effects that increase with higher doses if you want to take it every day. So don't take more than 1,000 milligrams a day. And frankly, this bottle says 180 milligrams or 400 IU. And they're talking about milligrams here. So when, for most people, it's okay to apply to the skin. And it's definitely okay to take orally. But if you do, it kind of mixes with other vitamins, so it needs to be a standalone in the middle of the day. I've mentioned some other things that you could take with it, like glutathione, and that's fine. They're both antioxidants, and believe it or not, vitamin E is an antioxidant, especially in reproductive health. And so there are reproductive disorders that make it so that a woman can't get pregnant. The fallopian tubes should be nice and white, and they should be clear from bumps, bruises, and there's lots of scar tissue on the inside with the endometriosis. And I know antioxidants helps with that. So there are symptoms of vitamin E deficiency, and believe it or not, it's loss of feeling in your arms and legs, and loss of body movement control, muscle weakness, and vision problems. What the heck, right? So you really should take vitamin C if you have an actual deficiency. A lot of people have muscle weakness and vision problems. But loss of feeling in arms and legs, very few people have that. And if they do, let's hope that their doctor is well versed enough in vitamins to know that they needed vitamin E. So if you have an actual deficiency, you should take it, but you can also start taking it in midday to see if it benefits um, something maybe that you're um, suffering with. I mean, a lot of seniors is important. It's important for a lot of seniors to use it because of the risk of bone fractures, and vitamin E helps prevent bone fractures. And you need more vitamin E as you age. So, it also, believe it or not, it doesn't help you lose weight. I mean, a lot of people think antioxidants help with that. This particular one doesn't. However, it suggests that vitamin E can help you um, tighten your skin as you get older. Vitamin E you can put it directly on your skin. It's supposed to help with the crepey skin. It tightens skin and things like that. So it's really great if you're making like your own facial ointments, like I do. I make my own, and it's great to add vitamin E for that antioxidant and healing the crepey skin, and giving your face something on the skin, as well as when you take collagen. So this is my one supplement indulgence that I use besides the perfect aminos. I like Heal and Soothe. So this is a very natural joint support supplement. It has proteolytic enzymes, turmeric extract, devil's claw, Mojave yucca root, rutin, bromelain, propane, boswellia extract, ginger extract, citrus, bioflavonoids. And with these together, it it not only soothes the joint and muscle discomfort that you get from having too many carbs, or your body being sore because you worked a little harder today than yesterday. And for some reason, when when we exercise, when we get older, for some reason it's harder on our muscles. Like the soreness when I was younger is like, oh, that feels good. I'm sore, because I worked out or whatever. But as you get older, that pain is much greater, and it has a lot more inflammation than when we're younger. And so I take this because I found that it alkalines my body quickly and reduces the pain. And when you have sugar, when you eat too many carbs, it's more of an acid in your body. And the best way to get rid of acid and pain is to alkaline. And so this is kind of a quick alkaline. You take 3 in the morning if you wake up and you're sore and you're not feeling well, or in the afternoon you're starting to feel, oh, I feel stiff, then take 3, or take 3 at night. But it's it's really, really, it's been the best thing for myself that I've ever used that helps me feel better. I don't take ibuprofen. I take turmeric. So turmeric, instead of reaching for ibuprofen, turmeric it's natural, it's much more safe. Ibuprofen, there's too many bad things that can happen while you take ibuprofen. It can cause blood clots. It can cause excess bleeding. So it can be both a blood clotter and cause your blood to be too thin and bleed. And so it's just so strange. And so that's why I like turmeric, or turmeric, whichever you want to say. So the Heal and Soothe, I found that it doesn't start working until about the 3rd day. So you got to take it a couple days in a row consecutively. And then if you want to take it every morning, it helps tremendously until you can get back on your diet or whatever. But I found that once you start taking it, it's like your body goes, oh, it's that again. Oh, thank you. It's really, really good. But some people do have an issue with it because of heartburn, but I never have. Just, um, but it does take a couple days for it to kick in. I like to keep this around. Um, there's, people that have bursitis, pain and inflammation, and just mostly from injury, that's where the inflammation likes to hang around. It's really really great. And there's, people with chronic pain, this is really good to take, and it's an okay thing to take every day. And you don't have to worry about mixing it with anything. You can take it with anything. Anything can be taken with it. And so some people, like if they have pain from a ripped muscle, this isn't going to help a healing pain, right? This could help soothe for the most part, but if you've like hurt yourself and you just need to give it time, like after a surgery, this is not going to help that. This is for like arthritis or chronic pain, and because it alkalines your body and gives your body what it needs to feel better. So I would recommend this if you're looking for something just to keep that under bay. But that doesn't mean you can go around eating sugar, but definitely when you have a party and you indulge and you've got to pay the price for that, the Heal and Soothe really helps you get through until you've fixed your diet and came back to it. Because once you start sugar, it's hard to stop. You just want to eat it every day because every day you get this urge to eat it. And, I told you once that all viruses are parasites. And a lot of problems with all these little pimples on the back of your arm, not you particularly, but people in general, it's from worms. When worms get the sugar, you start craving sugar almost right after we eat a meal because that's what they want you to eat. And once you eat it, they pee in your bloodstream and poop in your bloodstream, and that is acid. And it damages cells, it causes blood pressure to raise, and you just feel gross in general. You start to feel sick. You need to alkaline your body, and those kind of little creatures don't like an alkaline body. And when they pee and everything is when we get pain and inflammation. Their urination makes everything inflamed. So as I did a study, I have a veterinary guide that I've been looking at. As I did a study on parasites, everybody has parasites. And for a parasite cleanse, I've told you a little bit about that, but I did it more for the worms. Um, and how clove prevents the worms from hatching, the worm eggs from hatching. So if you can get rid of what the infection you already have, you can take the clove to prevent the worms from having a population. So anyway, there's all kinds of studies that you can do on doing cleanses. I would suggest once you get this up and going that you consider doing a type of cleanse to get rid of parasites. One cleanse that you can do is get 750 milligram capsules of castor oil from online somewhere, anywhere that has them, and you get enough for 5 capsules a night for at least a week. Okay, I think you're supposed to do it for a month, but you can try it for a week, and you're going to start seeing things come out of you like you've never known you had. And that's when you get up to a month. You completely clear it out, but at least freeze enough for 2 weeks. You have to freeze it for 2 weeks because it starts to melt in your tummy, and all the little worms and critters that sit up at the upper colon, your descending colon, as your food comes in, it's kind of waiting for that food, right? And so then that half melted castor oil starts coming down, and that kills worms. Castor oil kills worms and parasites. But parasites are another thing. If you dislodge a parasite, it will find another location to lodge. And we don't want traveling parasites because that could cause problems. We don't want it to go in anywhere, especially past the blood-brain barrier, which is very rare for that to happen. So if you're going to get on and try to do some sort of parasite or worm cleanse, you need to do your research because you don't want them moving. When you hit them hard for 2 weeks, then you back off a week, while you take clove, and then you hit them hard for 2 weeks, you back off a week, and you have to do this for 3 cycles, and that's for worms. And for parasites, I would also do that, but there's other cleanses we can talk about. I can do another video on cleanses with diatomaceous earth and other things. But anyway, this isn't for you to follow. All the things I said about cleanses, that's just to get you thinking. So once you've got your supplements worked out and you feel good about that, we can start doing a detox on your body. And the best restart and detox that you can do is to do a water fast where you only drink water. But for some people, because of the type of health that they're in, they cannot do that. And I would recommend that you talk to your doctor first about a long-term fast. I know 3 days can kill candida, but not many people can go that long because a lot of people use caffeine, and that would give them the headache of the century and probably make them feel sick and really mess with them. But intermittent fasting is also a way that you can improve your health, but it's not going to get rid of parasites and worms. So that is another video for another day. So do what you can to get your health up to par. And if you have any questions, just let me know.